We'll start off with opening remarks from the partners on this project. As I said, the manual was developed alongside our partners at UNAIDS and SANEC, and we have representatives from those organizations joining us today. We have Zinat Abdul from UNAIDS, and we have Nelson Dlamini from SANEC. So we'll give each of them a chance to give their opening remarks, but we'll start with Mama Ponya. Mama Ponya Motsai is the CEO of Frey College. We're a training college based in Johannesburg, and we provide short courses and accredited qualifications in journalism and communication across the African continent and beyond. So let me hand over to you then, Mama Ponya.
Thank you, Bridget. And welcome everyone. We're so glad you could join us, and we hope that we'll have a few more or a lot more people joining us, because it's such an important discussion we're having today. So welcome, and again, thank you so much for giving us your time, and to the panelists who are here as well, whom I will introduce later on. Again, also to you, welcome. So like my colleague Bridget said, my name is Mama Ponya Mutai. I'm the CEO of Frey College. We're one of the partners in this project, and where we actually started this in terms of this exact project last year. We had an in-person and a virtual, so a hybrid workshop for journalists on reporting on HIV in the region, so Southern Africa and Eastern Africa. And at the time, we were thinking about how we need to reinvigorate the discussion in our newsrooms and seeing more stories in our publications and in our mainstream media and our community medias about HIV, because we felt like we were being a little bit too relaxed as the media. And little did we know that a few months later, the need for this would be even more heightened, as we have seen with recent developments and the pulling of U.S. aid from our countries. And that has created a gap that will literally translate to, if not filled, translate to us moving backwards and translate to loss of life. And it's something as journalists, we need to engage journalists, we need to engage communicators, so that everybody is on hands on deck, all hands on deck. So we started this journey last year, really, but we are so glad we get to meet again today, to launch the manual, which I will tell you, the handbook, which I will tell you a little bit more about in a few minutes, and to have a discussion about what are the main issues that journalists need to be focusing on right now. Last year, when we met, we covered a range of issues, which from the technical aspect, because as journalists, there's always new developments when new research comes in, and we know that in journalism there's such a huge turnover of journalists right now. So we not only need to be adding on to what all journalists know, but we need to be making sure that the new journalists who are coming in are also knowledgeable and they receive the support they need to receive, because they are unlikely to receive that in the newsroom to be able to cover HIV well. So we covered those aspects, the technical aspects of or the scientific aspects, and we also spoke about we also spoke about the journalistic aspects of ethics and what topics to cover, and that is the idea we want to continue today. That we would help, if you are a journalist in the newsroom and you are here, if you are a communicator, we would help you understand some of the main issues that you need to be on the lookout for. We would help you understand what is in the manual, how it's going to be useful for you, where it's going to be, and also just get you in terms of idea sparking for what some of the issues you could start covering are. So we hope that as you listen in today, this will really be value for your time. And we hope that some of the things you get, you will also be sharing with your newsrooms and whoever you have in your sphere of influence in relation to communicating and reporting on HIV in Southern Africa and Eastern Africa. So I will come back a little later to just introduce the handbook in a little bit more detail. But again, thank you so much for joining us. And I look forward to the discussions that we'll be having. Like my colleague Bridget said, please do feel free to put your questions or comments in the chat so that when we get to the question and answer time or as we move along, we can be addressing some of those as we move along. But welcome, and again, thank you for joining us.
Thank you, Mama Ponya, for those opening remarks and setting the context for our discussion today. I'd now like to call upon another one of our partners. The representative joining us today is Zinat Abdul. She is the Communication and Advocacy Officer for the UNAIDS South Africa office. She's been a communicator for the UN for 9 years, including 2 at UNAIDS. Her work with the UN follows her decade-long award-winning experience in South African newsrooms, including community media and the SABC in various capacities. She holds a teaching degree, a master's in communication, and an honors degree in counseling psychology. Welcome, Zinat. I'll hand over to you for your opening comments then.
Thank you so much, Bridget. Thank you very much. Good morning, everyone. And thank you so much to echo what Mampanya has said. Thank you so much for joining us and participating with us today. First of all, I want to say a massive thank you to Frey College and Nelson and the team from the South African National AIDS Council for their fierce support over the past 2 years with the journalism training and which has led us to this point, which is the development of this particular handbook. I want to share with you why I believe that this handbook matters. And for the many of us who have been in the HIV space for a very long time, this handbook may not come across as groundbreaking. It may come across as basic. But as Mamponya has said in her introduction, or as Bridget has indicated, I have a teaching degree. So yes, I'm a qualified maths and English teacher who took up a holiday job at a community radio station in my hometown, Indonesia. And thereafter, about 1.5 years later, I moved to the SABC, and I would often hear my colleagues talk about their internships at various newsrooms and their so-called journalism days. And I would look at them with admiration, but at the same time, it also fueled what I had was called imposter syndrome, because everything I knew about journalism and everything that I did was learned from experience and no journalism school at the time. It was very much the same when it came to the topic of HIV. So I remember covering the story of HIV. Of course, I knew what was HIV. I knew the fight for treatment in South Africa. But as a young Indian girl in a small town of Lenasia, HIV was not something I could relate to. And I think I would have appreciated a handbook like this one, because I believe it would have provided me with an opportunity to know and understand the terminology better, and also the topical conversations. What did help me, though, was Frey College. So like many of my colleagues, including Zbo Nkosi, who's sitting on the panel today, the training I received as an International Women in Media Fellow through Frey College helped shape my understanding of the key issues around HIV. Did it help my imposter syndrome? In a way, because there were also colleagues that were talking already then, and I'm talking, this is now 2009, 2010, were already talking about financing the HIV response, a conversation that I felt was way above me. They were also talking about sustainability of the HIV response, which today makes a lot of sense to me. I now understand it. And that particular training and interacting with those colleagues benefited me to understand what those conversations look like. But I do remember covering a very interesting story, and it was about domestic workers living with HIV. And so in my small town of Lenasia, it was not uncommon to hear of domestic workers being fired as soon as their madams, employers, found out they were HIV positive. In fact, there was an aunt of mine who was a nurse who brought it to my attention, who found out that her domestic worker was HIV positive. And she said, I'm a nurse. I cannot fire her. I know that HIV cannot be transmitted like this and through cutting of meat, etc., etc. And that is what prompted me to tell the story around stigma and discrimination, which very much remains relevant today. Today, we are seeing newsrooms shrinking. We once had health reporters, and today we're seeing a reporter is assigned on the budget of yesterday, and last week the 1.1 million campaign. But this handbook is for you, the new journalist, the journalist whose beat is not necessarily health, and the journalists who are just starting to make their mark. The journalist who likes me, who like me, suffer from imposter syndrome and could benefit from a boost of confidence, who wants to understand what are the 95, 95, 95 targets and why do we constantly hear about these targets and how close are we to achieving those targets and why does it matter? The journalist who struggles to understand what does it mean when we talk about prevention as treatment? What is lenacapavir? How does one even pronounce it? What is len? Is it the same thing? Why is there such a big discussion around it? What is the financing of HIV? Where does it come in? At UNAIDS, it seems like life has come back full circle for me because as I covered HIV as a reporter, today I'm hoping to strengthen newsrooms to accurately report on HIV. The one thing I will always add is that HIV isn't a story. It's personal. It's a lived experience for 7.8 million people in this country of ours. And as people who are in this field and as reporters, it is our responsibility to ensure that we continue to advocate for their story to be told, so they too can live a life free from stigma and discrimination with access to all their health and human rights. So I'm very grateful, and I have a huge, massive thank you to the Frey College team, not just for this particular handbook, not just for their support over the journalism training, but for shaping me as a reporter to be able to provide assistance and to tell the story, the very personal story for those living with HIV, to continue to advocate for their health and their human rights. Thank you very much, Bridget. Thank you very much, Senek. And thank you very much, Mama Ponya. And to all our panelists as well, thank you for participating. And for all the journalists that are joining us today, thank you very much for sharing this important moment with us.
Thank you, Zinat, for those personal and very powerful words and introductory comments. I'd like to now call on our third partner who is going to give some introductory words. This is Mr. Nelson Dlamini, the representative from SANAC, the South African National AIDS Council. A journalist by profession, Nelson Dlamini began his career in mainstream media, having worked at independent newspapers, Caxton magazines, and the SABC. He ventured into the health and development communication space and worked in national and international organizations such as For Africa HQ, a humanitarian organization with offices in 13 countries of Europe, America, and Africa. He also worked at the SA History Archive at Wits University and Health Systems Trust. He's been working for the SA National AIDS Council for 9 years, and he currently serves as the executive manager responsible for strategic initiatives and communications. He holds a BTech in journalism, an honors in journalism, a certificate in development communications, and a higher certificate in legal studies. Welcome, Mr. Dlamini. I'll hand over to you for your introductory comments.
Thank you very much. I hope I'm audible. I am in a conference venue at another engagement, and I hope the background noise will not be too much of a distraction. Good morning to you, and good morning to all the colleagues on the call. And just to touch on what Mama Ponya said, how we even got to starting this journey. We were at the SA AIDS conference in Durban. I think it was the first time meeting Zinat shortly after she had started at UNAIDS, and she was like, "Have you noticed how superficial reporting has become on issues of HIV? It's like the very basic stuff." And then we went on to a conversation about, but how can we change it, and can we really blame them? Do they have access to information? Are they updated? There's so much happening in the space. There are so many developments happening in the HIV management space, and therefore, if we don't take our media colleagues along, then the reporting will forever remain the way it is. And then that then gave rise to the media training. And I think Frey College was by far the best media training partner we could have ever asked for. They both have touched on this. The challenges in the newsrooms, things were a bit different when we were there. There was luxury to specialize and focus on a particular beat. I remember when I started, you obviously start with general news, and then the news editor would see, how, the type of writing style and your passions and all of that, and then they start channeling you towards particular news beats. And then I ended up writing lifestyle, and I stayed with lifestyle for the longest of time. But, with the media landscape suffering losses, particularly from the side of print and all of that, it's very difficult now. Newsrooms are constrained, and one journalist has to be a jack of all trades. There are very few newsrooms that have the luxury of ensuring that journalists focus on a particular beat, which is helpful, that focus, because the more you do it, the more you are exposed to, emerging priorities, new developments, etc., and it enables you then to carry the stories with the nuances and the relevant information, accurate information that is there. So this training is important in closing that gap, to ensure that, in as much as they are operating with very with small teams, without the luxury of any one of them having to specialize on a particular beat, at least we can then close the gap in ensuring that we capacitate them, so that we can start seeing that accurate reporting. There are a lot of developments in the HIV space, as Nat was saying, these new prevention tools that are coming up, the work around the vaccine research and all of that. The priorities have shifted from the days when the biggest thing was awareness of what this thing is, driving people to test, but now the priorities are quite different. I think even when you're looking at the UNAIDS 95 targets, we are doing well on testing, but the biggest challenge now lies within the second 95, which is initiation and retention to treatment. So our approach and the kind of reporting we would like to see is the type that would then help us close that gap, and help us address the other issues that we witness on the ground. So we hope that this manual will be useful in that, but also we want to sustain the media training and move from province to province, so that it's a continuous touch base, so to speak, with our media colleagues on the ground, to ensure that we are with them all the way. And thank you, Frey College, for organizing this webinar as well, to launch this manual and all the work that you've been doing to make it a reality. Thank you so much.
Thank you very much, Nelson, for joining us and for your comments and for making time in your busy schedule to speak to us today. So the core reason we gathered here today is to introduce this new tool to help journalists in Eastern and Southern Africa to report on HIV. So I'm going to hand over to Frey College CEO Mamaponya again to introduce the manual and discuss a bit about what it contains. And from there, after the introduction of the manual, we'll lead straight into the panel discussion, which Mamaponya will moderate as well. Over to you, Mamaponya.
Thanks, Bridget. Yeah, so I have the wonderful honor of introducing this handbook to everyone first time. And before I do, I want to reiterate something that Zenith said, that this is not meant to be a groundbreaking, completely wildly new document, but this is meant to be something that anyone in the newsroom and everyone in the newsroom who needs a reference point, who needs a starting point or a refresher, can go to and get out of it having found some really useful information. Because we must be clear that, especially in our region, especially in Eastern and Southern Africa, HIV cannot be in our newsroom, cannot be an exclusive topic where only that person knows because they are the specialist. For many reasons. One, because most journalists have to report on multiple things anyway. But two, because at some point, most journalists or all journalists will have to talk about HIV in some capacity or another, because HIV is not just a health story. It's an economic story, it's a social story, it's a gender story. And so it's important that all of us, regardless of our years of experience as journalists or as specialists, we be able to have some common um, foundational information that we all move from. And this is also from practical knowledge. Sometimes when we're working with journalists, and we're talking about HIV, you can tell that there's just that little bit of uncertainty. Like, I know, but I don't really know if what I know is true. I've had this, but I'm not sure. So this is meant to be a document that grounds journalists and other communicators in fact and in just making them more confident and giving them a more confident base. So I will just share. So this is what the cover page looks like. Um, and you will, I think Lucero will share in the chat group a link that you can go to download it. But this is the manual. It's a relatively short document. I mean, there's a lot of things we could talk about, but this is a relatively short document, easy to consume. I'll show you just what it looks like just now. But really, just quickly, the main purpose of this, like I said, is that you would have a document that provides quick, useful, factual information. If you're unsure about something, even just it has a terminology or a glossary, even when, lately we've been talking a lot about injectables. And sometimes because you hear that word uh, on the radio or you read about it a lot, you could assume that you know, but you don't actually really know until you also do your own reading about it. So it provides quick, useful information on the latest, on the latest research and updates, what's happening within the HIV landscape. But I want to say, though it provides this quick, useful, factual information, it's not to be meant to be your where you stop. It's meant to be a starting point that can help you think of other people, or even from the references that we put, because the manual is put together using other people's information, especially in the statistics part. It's meant to kind of also point you to people that you could go to keep the conversation going. So it's not meant to be where you start and where you end. It's meant to be where you start and propelling you to other places so that you can tell the story better. If all you have is the handbook, I fear your story will not be good enough, because that's not what the handbook is about. It's about to enhancing your foundation, but you need to broaden the information. So it's also meant to spark your curiosity and make you more curious to know more, and be more factual. So it contains practical tips and considerations as well. It contains the elements like your statistics, um, which organizations like UNAIDS update annually. So, for example, UNAIDS has a report they do annually, which updates where different countries are in terms of HIV prevention and treatment. And those are things that as a journalist you want to have bookmark for yourself, not just as a I can go here, but also as a this happens annually. So when it's updated, I want to be one of the first to know so that my reporting can be more relevant. And really to just reignite interest and enthusiasm in reporting on HIV, because for the past few years, that interest has died down, almost as if in newsrooms, the problem is solved. But that is not the case. Yes, we have made great progress. I mean, if you just compare the deaths 20 years, 10 years ago to what we have now, deaths that are that are related to HIV, yes, there has been great progress, but a lot still needs to be done. Just in our region, in Southern Africa, South Africa remains the country with the highest number of people living with HIV. Eswatini remains the country with the highest prevalence. And now, after the pullout, America pulling out from funding HIV programs, we are even more vulnerable. We are the regions that will be even more vulnerable. So in a way, we hope that the dramatic things that have happened recently will also be part of reigniting that. But even if that had not happened, as newsrooms, we need to remember that HIV and AIDS are still a huge problem. And because they are a problem, they will continue to impact on society. They will continue to impact on inequality. They will continue to impact on vulnerable genders. They will continue to impact on our economy. So it's something that we can never put in the back burner, and we hope that this manual will reinvigorate that curiosity, that interest. And I hope that those of you who are here from the discussion that we will have after this, you will also be getting just some ideas of the stories that you can follow up on, and connect to the stats and what's happening. So I did show the cover page, and this is what the contents page looks like. You will see it has the glossary, it has an introduction which starts with the role of the journalist, because everything just makes sense once you understand the why. And then we have a snapshot of Eastern and Southern Africa. This is data collected from the UNAIDS report that's produced annually, just to give us a sense of what's happening in the two regions. And you know, we always encourage that you always look at data with a human lens. The numbers do not mean anything without the humans. So as you are going through the stats section, it's not just numbers, it's people's lives. And as a journalist or as a communicator, your job is to be thinking about that, is to be thinking about how do these numbers translate to human life, because that's the story you need to tell. Um, for example, you will, there's a bit in the handbook about the vulnerability of young women in particular, and I feel like we always speak about that, and we don't speak to the young women. Um, we there's such little reporting that's now with human faces on HIV. It's a little bit worrying, and I know that there are measures to be ethical measures and protecting people living with HIV, and I know that. And part of the manual is helping you. You will see there's a section on ethics of reporting on HIV, helping you in those kind of consideration, but having those considerations does not mean not making an attempt to find those people and give them a voice and help everyone understand really from the point of view of the people involved what is happening, why, and what some of the solutions needed could be. So we have the statistics. We have a section on children and HIV because we one of the areas that has not been improving as much as the general trends in adults in terms of prevention and treatment is the area of children. So we want to see more reporting on children infected with HIV, and so that mothers and fathers, again, mothers and fathers, because one of the things we want to stop doing is just placing the burden only on mothers, so that mothers and fathers can make sure that they are keeping themselves safe. And if their children are infected, those children are getting treatment. And so we have those sections. And then in terms of the more journalistic topics, we have sections on reporting on the ethics. We have social media storytelling. And the social media storytelling part is so important because we know right now that people, especially young people between the ages of 15 and around 35, they are not getting information from websites, from the traditional media, so to say. They're getting information from social media. And so far, journalists have been a little bit rigid in adapting to how social media works, and we need to change that. And so this section on social media storytelling really engages journalists on how they could, be better at social media storytelling, because that is where people are. And we cannot sit on the side hating on the influencers. We need to get into the game and experiment until we find what works for our audience so that we can engage them on social media and give them factual, relevant, life-saving information on social media. We know that, for example, in Kenya, um, Kenya is the number one user of TikTok globally. South Africa is somewhere in the top five. Those are two countries in our region that are leading in that platform in terms of the number of users there. So that says to us as communicators, what are we doing on those platforms to engage people on HIV so that they're not just living on a diet of dense videos and ridiculous challenges, TikTok challenges, but we are also feeding them life-saving information that will change our communities. We need to be able to tell stories well on social media. And then also creating multimedia content, some tips around there, and narrative storytelling. Again, because these stories will not have an impact. These stories mean nothing if they are not about people. And we need to come back to the idea of having people-centered stories, not just, the UNAIDS, for example, will in a few weeks or a few months be releasing this year's report, it's not just about the numbers, it's about the people who are impacted by the numbers. So once we have the numbers, how do we bring that narrative element, that human interest element? And by the way, this is part of the survival of journalism. We know that journalism is under a huge strain financially. There's huge concerns, around the financial sustainability of journalism. So one of the things that the media organizations need to do is invest in good storytelling. Because the facts people can get from anywhere. It's the storytelling that's factual, that goes in depth, that makes our media houses different from any Tom, Dick, and Harry who can apply, who can do a podcast, start a blog, post on X, post on wherever. So this gives you a sense of what is there. Like I said, this is what it looks like. The role of journalists. I spoke about that. We try to make the graphs as simple as possible. We know journalists don't like numbers, and we try to simplify all of that as much as possible. And again, the last page has our email. The last page has our email, so that if you have any queries, or if there's something that you want to talk to us about regarding the handbook, you're able to contact us, and we'll engage you with that. So that's a little bit of what the handbook looks like. And I just want to just quickly scrunch through to see if there are any comments that we want to engage before we go into our panel discussion. Okay, we'll come back to this. We'll come back to this because I want us to have as much time as possible with our panelists. We are very honored to have a panelist that represents people from the different regions. And that was important for us because, this is also as a way for the journalists, again, reminding you that there are other people you can continue having conversations with. You know, there's people in each country who, on a daily basis, work with those infected with HIV, and they work with these issues and they understand them in depth. People that are not just government and the government health officials. And it's important that as journalists we continue to engage these people. So we are very honored to have a panelist that is representative of our region today. And again, before I just introduce them, as they are speaking, our hope is also that you will be writing down some story ideas and you'll be listening to them thinking, oh, what does that mean for my newsroom? What does that mean for a story I could do? So that we are continuing the conversation. And also, you are just taking down their names and organization and planning to form those relationships with them if you have not already done so. So we have three members of our panel today. I'll start with Spongile. Spongile Ngosi, who is the co-executive director of GNP, and she is Spongile is a Black feminist of over 10 years. She has over 10 years experience in journalism and public policy and advocating for advocacy campaign and movement building. She has a journalism and she has held journalism and management positions with reputable South African organizations such as Health E-News, Treatment Action Campaign, and Mail and Guardian. If you know those organizations, those are some of our leading organizations in their industries. In South Africa, she has consulted for media development agencies and global health organizations, including the Global Fund. Sibongile possesses a wealth of knowledge and experience on the intersectionality of gender, health, and race. She holds a master's in globalization, business, and development from the Institute of Development Studies in Sussex University. So we're very honored to have you here with us, Sibongile. And the lovely thing about the organization that Sibongile works for, GNP Plus, or Global Network of People Living with HIV, is that it's a regional network. So it's not just based in one country. So Sibongile can kind of give us a sense of what's happening in the region as a whole. We also have joining us Tasha Sandra Muyira from Femme Alliance Uganda. Femme Alliance is a lesbian and trans and gender diverse organization in Uganda. And again, those of you who know the stance of the Ugandan government on the LGBTQI community will know how important and how dangerous sometimes organizations like Femme Alliance are, and how much in danger the people there can be sometimes. So we're really honored, Tasha, to have you here with us. So Tasha is a proud Ugandan queer woman and the program and finance manager at Femme Alliance, an organization at the forefront of advocating for the rights on protection of LGBTQ individuals. She has a deep commitment to inclusion, human rights, and her work centers on ensuring that every LGBTQ person can live in dignity and equal opportunity. And we know that now, more than recently, now with the pulling out of the US aid money, that's even more endangered because some of our governments are simply not willing to fund programs that are protecting and giving health services, basic health services to people in the queer community. So welcome and thank you for joining us. Welcome and thank you for joining us, Tasha. And then last but not least, we have another Sibongile. This is now Sibongile Chabalala, who is the national chairperson for the Treatment Action Campaign. Sibongile is a mother and an HIV activist. She currently serves as the national chairperson of the Treatment Action Campaign, which, by the way, the Treatment Action Campaign has a phenomenal history. It's such a big part of the history of HIV prevention and treatment in South Africa. And we know, those of you who do know, that history is not a really great one. And part of how far we've come is because of organizations and the passionate activists who work at organizations like TAC. So Sibongile began at TAC in 2009 as a branch manager, and then served as a branch chairperson in Vosloorus. Vosloorus is a township east of Johannesburg. And in 2012, she was elected as the Gauteng provincial chairperson. And in 2015, she was co-opted as the Deputy General Secretary, and now she's the national chairperson. And again, that speaks to Sibongile's vision, Sibongile's passion, and Sibongile's leadership quality when it comes to the issue of advocacy and fighting for the rights and equality of those living with HIV. So again, to all three of our panelists, thank you so much for joining us. And I'm really excited to start this discussion. I just want to, hi, Tasha. Are you able to open your camera, Tasha?
Hi, everyone. Unfortunately, I may not be in position. I am in a rural area, and where I am is not that very safe.
Okay, it's great. We can hear you perfectly, so that works for me.
Thank you.
Okay, I just want to kick us off with just your thoughts, and we can start with Sibongile T. Your thoughts on how HIV has been covered recently in South Africa and in our region in general, and where you have seen, like, as someone who is deeply embedded in and deeply passionate about the issue, where you have seen the gaps, or where you feel like, no, we're really doing well here and we need to do more of it, and we're lacking here and we need to fill these gaps.
Oh, thank you, Mama Ponya, for that question. And thank you for everyone who have joined the webinar. Thank you to the funders or the group, SANAC, UNAIDS, for organizing this webinar. I think it's one of the important webinars that, as activists, we really appreciate. And also, I think you know that we are making a lot of noise to say recently we are not seeing much of HIV news, HIV reporting, other than when there are things that are happening like now, when there is this funding freezing. Every journalist wants to talk to us. Every journalist wants something for us. Sometimes they even want some things that are beyond our control, but everyone is really interested now because it's in the news. Everyone wants to talk about it, but HIV, it's not as something that is coming once in a while. HIV, it's something that we are living with every day of our lives. And it's something that we are always having challenges that we would like communities or anyone or a journalist to write about them, to say, this is how we are suffering, or this is how we are accessing services, and this is where we are as activists, also as governments, in terms of fighting HIV. But what we normally know is that when it's World AIDS Day, my phone won't stop crying, won't stop ringing. When it's World TB Day, my phone won't stop ringing. When there is a report, it's being presented publicly, my phone won't stop ringing. But we have challenges every day. So what we would like to see more is just those stories about people living with HIV. It's that those stories about how people living with HIV are surviving. What are the challenges? What are the successes? What works well for us? What doesn't work well for us? Because everyone always sees us on the news when we are complaining, when we are telling the stats that are not good, when we are almost not happy about what is happening in the HIV space. But when there is something good, there is less interest. Like, for instance, in your report, you spoke about journalists must learn this language about Lena Kepave, what is a learn, what are the new developments. We don't see much of that coming in the media. It's only 1-2 journalists who are interested in that, and others, they don't care about that. We want to see that more, because people are interested on the ground to know what is really happening, what are the new developments. And also we would like to see more of clarity reporting of the news. I can just tell you a bit of a story that happens a few weeks ago. One of my friends who knows that I'm an activist, and every time when there's something new coming up, they will come and verify with me to say, this is true. When the Department of Health issued the circular because of the a funding freeze from PEPFAR to say now they are saying clinics must provide 6 multi-month medication to patients. People, they thought that it's one pill for 6 months. So you can tell that so much disinformation. And I kept on saying, no, that is not that. And he said, no, I heard it on the radio. This is how they said it. But you have to continue to educate and emphasize to people to say, this is what they meant. So if we just have that 5 minutes of talking about HIV and then we focus on other things, a person will grab what means to the person, and sometimes with not full information. So I think journalists are doing a good job, and they were doing a good job for a very long time. And the hype and excitement, and everyone wants to talk about HIV that we're seeing now. We would like to see it moving forward, not just once off when there is something that everybody's talking about. Thank you.
Thank you, Sibongile T. And just to keep that going, because I do think that it's such a huge problem.
Yeah.
This issue where journalists are only there when there's hype around it, and they don't follow up. Once they've moved, they've moved. And Sibongile N, since you have worked quite extensively in newsrooms, how do we deal with that? How do we improve on that? How do we encourage journalists to continuously see the HIV story as a story that needs to be in our news, just like we do corruption?
Firstly, I just want to acknowledge that this is such an important tool, particularly for journalists. And I also want to say that just thank you to the partners for developing this. When I was a journalist, we didn't have this. And I guess just to answer your question, and also just to also acknowledge Sibongile here, I think that she's like the person that works in the country a lot. I've moved globally, and globally is a different conversations. But I want to answer your question just by starting to say, I think we have to see HIV as a broader health issue, right? And we have to locate it in the politics of health, in the politics of service delivery, in the politics of quality of life for people. Particularly, I mean, if you look at the stats in South Africa and the number of people living in South Africa with HIV, and if we don't then do that, then it as Sibongile said, then we will always honor it as an event, and it's not an event, and that's why we've always covered HIV, particularly looking at it from an intersectionality lens. So I'll tell you one example. I think that should be happening now is that we are seeing that there's a funding crisis, right? And one of the things I was frustrated with in South Africa, particularly, is that we saw a lot of media reports, which was great, that the issue was coming. But I think that there was a level of, and I guess it goes also with the level of where journalism is and the type of journalist that you want to be, right? You have to ask yourself, do you want to do fast-paced journalism where you burn the story now and you quickly report on it? Or do you want to tell a compelling story? And for you to tell a compelling, and also you have to ask yourself, what impact do you want? When you produce a health story, you need to ask yourself, what is the impact of my health story? Who do I actually want to speak to? Do I want to speak to the general public, or do I also want to speak to the policymakers? And that is the basis of health reporting. Those are you have to ask yourself, where do I want my story to go to? And then secondly, then ask yourself that as you're seeing things coming on board, what is the question that I need to answer for my audience, for people that has not yet been answered? Particularly in South Africa, we saw the funding cuts. What the stories that were coming out was that it's 17% of the HIV, 17% of the budget of the HIV response. What was missing in the stories that we saw was that Where was the 17% going into? Is it providing ARVs? In which district is it providing ARVs? Or is it for research to actually contribute to more treatment advances? Or is it for workers? And that was those are already three stories that journalists could have found opportunities to cover. And that also then speaks to a much broader health, because if the angle of the story was that due to the 17% of the cut in the budget for HIV response, we are losing a workforce of community healthcare workers that can contribute to actually more health outcomes, not just HIV. So I do think that there's a lot of creativity and a lot of asking of questions, because when I was reporting on health, we didn't have the tools. We just had, and another thing is, I think right now, where journalism is at also is that there isn't enough funding coming from the global actors to actually fund journalists to be able to still produce. I think some of us had that opportunity, that there was still funding to actually produce health reporting. I think Open Society Foundation was one of the biggest donors, and Wraith Foundation was one of the biggest donors that was contributing to journalism, to covering health in the country. But I think it's that we need to locate HIV within a health service delivery conversation. And I do think that right now, Sibongile is one of the best people that the journalists need to link with, because what the Treatment Action Campaign was able to do 5 years, 10 years ago, was able to see that we will be here. And where are we right now with HIV? I'll tell you. The world is saying, international donors and governments are saying the HIV pandemic is not an emergency. And countries in Africa now need to make sure that it lies within their public health system. And what the Treatment Action Campaign was really great at is to say, we will now look at our public health system to ensure that people are able to access services, including HIV. And I do think that there's a lot of opportunities and a lot of stories if journalists are looking at HIV from a public health response and work with the Treatment Action Campaign, I will say every day, then they will be able to produce the best stories.
Mm. Yeah, thank you for that. Yeah, there are a lot of issues that are not being investigated enough because only one or two journalists are really invested in the HIV story. Thank you for that, Spongile. I'll come to you, Tasha. Tasha, just going back to my first question about where you see the gaps, and for me, Tasha, if you could also speak to us, because you are based in a country in Uganda where, unlike South Africa, where from a policy point of view, the government will say we're very supportive of the queer community, we're very supportive of trans people. Um, um, but in a country like Uganda, the government is very hostile, and that I can imagine makes the reporting on the issues that trans people face in terms of access to HIV treatment. It makes it even way harder, even for journalists who maybe even want to report, they can't even do that. Tasha?
Yes, thank you very much, and thank you for having us. Well, as a queer person working in a criminalized environment, after the passing of the AHA 2023, that's when we found the most difficult challenges ever when it comes to our work. So, and we have managed to re-strategize and ensure that we work around the aspects of stigma, discrimination, looking at the real life experiences, and also the intersection, sorry about that, and also the intersection of various aspects, especially around health. It gets difficult every day from our own understanding or from the eye or the lens of a typical everyday queer person in Uganda. Yeah. So, sorry, Phil. And then also on top of that, currently with Currently, with the new Trump's rule, things have become more challenging, and with the limited support from journalists, it gets worse because many times, if we look at persons who are representing us here in the journalist aspect, they are actually so much aligned towards the government and then understanding the real life experiences. Let them look away. They don't even look away from the fact that before I am queer or before I'm gay, I am actually a person, a human being who needs the services, who need HIV services, who needs the health services. So many times we end up being buried by the journalists themselves, and it gets harder. When it comes to HIV prevention in Uganda, we have inadequate funding, and even the resource allocation gets complicated because many times you are also grouped in different groups like the key population, and they don't actually even talk about which particular group. We are all put in the same, giving limited resources. So the prevention measures are also limited, and especially those targeting the high risk or marginalized groups, there's really lack of scale and reach to enable it be necessary. Then also we move every day with the stigma and discrimination, the social stigma, particularly towards the LGBTI community, which continuously hinders access to testing, counseling, prevention services. Even organizations that are providing these services now, like us who have the drop-in centers where we have communities who can come and get these services, we have been pushed to the margins because of these constant changes away from the from the Anti-Homosexuality Act, now also the Trump's rule. The UNAIDS has cut off funding, and most, for instance, in our organization, 80% of our funding was coming from organizations that are directly funded by UNAIDS. So that means 80% of our funding has been cut off, and hence we can't reach everyone like the way we were doing before. Then also we find issues of limited tailored interventions. Our community has diverse or unique needs, and many times we end up being basketed and assuming that if you're a woman, those are the need that will cater to a woman. But we have persons who are transitioning, we have gender diverse groups, and there is never tailored messages or services to give them essential, and effective prevention. And the other thing we face every day is the integration of broader health services. HIV prevention can be effective when integrated with other SRHR health services. Currently in Uganda, away from the fact that even we're being criminalized, we can't access even SRHR services. And if you can't access those basic SRHR services, that means also HIV prevention gets harder because we get the hit straight from even the health workers themselves, from the places we go to get these services. It's a constant battle for all of us, and especially if you're living with HIV and identifying as an LGBTI person, it gets harder every day. Yeah, I think those are some of the constant challenges we face here in Uganda, especially for a person who identifies as LGBTQI. Thank you.
And Tasha, do you think there is a role that media from the neighboring countries can play that maybe the local journalists cannot? And I'll tell you why, because I think, because health issues are not contained in a country, right? if a neighboring country or a country in the region has a health problem, it's bound to then impact the countries neighboring it. Um, and and I'm wondering, I know with some issues like politics, journalists who cannot say what they want to say in their countries often end up working for media houses, international media houses, so they can speak more boldly. Do you think there is a certain level to which media houses from neighboring countries can fill the gap, maybe where media houses in Uganda cannot?
Yes, we believe what we have come to understand is every day is a challenge, and every voice we hear or every voice that adds on to a cause pushes us further. So if our media houses in Uganda are failed to have that impact, probably listening from people outside Uganda who understand better our position, who can get to understand our issues, and let them out there without any fears of being maybe closed down, fears of being taken away or disappearing or being arrested. If we can have other voices, it will rain eventually. If we have other support from other people, it eventually rains, because then that means other governments can see the wrongs that are going on within our country. That means other people can actually understand what's happening in Uganda. So if we have other media houses supporting us, well, I think it will bring a very big change and it will be impactful. It might be slow, truthfully, because when it comes to politics in our country, our own doesn't care. Whatever you say, people are given the freedom to make a lot of noise on social media and then nothing's going to be done about it. But probably at the end of it all, whenever we have all the heat from different countries and different, spaces, it will down on them. It will down on the government, because other governments will be interfering one way or the other. So we believe yes, and that's why whenever we get an opportunity to engage any other country to support us when it comes to media, to support us when it comes to journalism, to support us when it comes to voicing us out, we take up the opportunity, because many times this is when they listen. They listen when it's outside Uganda. So we believe it can create a big impact.
Yeah. And for me with that, Tasha, it's not even just about the politicians themselves, but as Ugandans begin to hear a different narrative and their attitudes change, that in a long term has huge implications on how the attitudes that people have towards either the queer community or just people living with HIV. Because I always say that our politicians are in a way a reflection of our society. So if our society could change, that when people move up to those high positions, they would change. So even if the current politicians are not being changed, but if we could change our society so that the ones who will be in power tomorrow have a different point of view, long term we could get somewhere. But thank you for that, Tasha. And I hope that the journalists in the room, especially those who are editors and have a little bit more influence, consider this issue about also reporting our neighbors' issues, because African media does not report on each other. I have better chances of finding out more about Uganda on BBC than I do on SABC. And that's something we also need to deal with. Spongile T, I'll come back to you. Just so I wanted to ask you about the role of media with reporting on the vulnerable communities. And in this instance, I want to ask you particularly about young women. In South Africa, for example, for years we have been saying young women are most vulnerable. They are, however many times they are twice or likely to get HIV infections than their male counterparts. And it's been years we've been singing this song. It's been years we've been saying the stats. So what is it that we can do, or what is it that journalists can do to have an impact so that we're not just saying it, but now we are actually working towards solution and making sure that we are helping that vulnerable group and making an impact instead of just repeating the stats that's always shocking to us and worrying to us.
Yeah, Mama Ponya, sometimes I always say people, journalists are really interested on the stats, and we are not stats, we are human beings. Coming back to the issue of young people, there are conversations that are happening in communities. And, sometimes it's really frustrating. And I always fight with our communications people to say, when we need journalists to come and cover the stories on the ground, when we want them to our community dialogues, where they will hear what young people are saying, how young women when they are talking about their own challenge, they are not there. And you'll find that sometimes it's very frustrating because the journalist, they will say, okay, I will come, but just like that, they will say, no, there's a story coming up, and the minister is speaking on this, so we can't lose this story, so we are dumping you for these ones. So I always fight with our comms person to say, why should I go and speak when they need me to speak? When I want them to come and listen to what is really happening on the ground, they are not there. So there is a lot that is happening on the ground in terms of reaching out to young people. We have like Insanak Zikalaganja, which it's one of the great youth-led campaign, but you hardly hear in the media about it. We want to see those talk shows that you used to have when you, like, let me say, just make an example now. We have your talk shows that sometimes I feel they're meaningless for us. Queens of the Night. What are we teaching our children about Queens of the Night? Instead of having those kind of concept from the media and journalists, how about we have concept where we are saying conversations with young people? What are your challenges? Let's give young people a space to speak out. But we are speaking to the young peoples in those little corners. And even what we are getting from them, it's difficult to disseminate that information. It's difficult for other young people to learn from others to say, how did we survive? Young people are raped each and every day. Mama Ponya, every day I go to sleep, my heart, it's heavy on me because every day I have to talk to one young person to support that young person. But those stories, you won't see them in the media. You won't hear any journalist saying, I want to support this young person, just one person, and take that story through, even if we are supporting this young person anonymously. There are young people who need PrEP. How many journalists are comfortable to speak about PrEP or do a show about PrEP or have a 30 minutes news discussion about PrEP? We hardly see that, where the young people will be invited to do that. So there is a lot that journalists can do and in terms of fighting HIV, but the question is, what are you interested in, and what sells the news? We understand sometimes you want what sells the news, but we cannot just bend the news when it needs someone. And with young people, I think all of us here and outside, we need to agree that we have failed our own children. I'm old enough to be mother of many of young children. I have a teenager that needs, that is always on social media, that I always monitor his social media to say, you can't be on TikTok from this time to this time. You need to be on your books from this time to this time. How are we using those social media to encourage young people to say, you need to take PrEP. This is what PrEP is doing. And we have learned, and you can't access it because it's very expensive. You have to fight for it so that you can have it. We don't have condoms because condoms boring or whatever that they are saying, but there are other options. But we are quick to say, these numbers of young people being infected. We've been talking about young girls. Now we are talking about young girls, young boys. I mean to say, numbers are rising. Numbers of young boys who are infected with HIV are rising again now. That's the topic, and it's not enough for us to just see the numbers. We need to see the numbers reducing, and we need to see more people living better. And with all that is happening now, all of us, even the journalists, they're just asking to say, what do you see? What do you anticipate in the future? What do we anticipate in the future as an activist, as a mother? More young children will be infected with HIV. By 2030, we'll see more deaths of young people because they will not be able to access ARVs, even though in some countries like ours, they are available. But already, if you can go to our website, people are unable to access ARVs. We are seeing the impact. People from North South Africa are not able to access ARVs. There's a lot that is happening, which we want journalists to cover these stories every day so that we can tell the story, because the Department of Health, the government, they always get this platform, and you always run to them, and they're not telling the honest truth of what is happening. Come to the ground. Let us give you the stories. There are stories. There are people who are going through a lot. As I'm telling you, if you can go to our website today, one Malawian is scared to go to the facility because that person was taking ARVs in a drop-in center. But because now the drop-in center is closed due to the fund freezing, now the person is scared to go to the public healthcare sector. What Usbongile was talking about, to say, we've been fighting to say, let's fix our public healthcare sector so that it can accommodate everyone. But people are not uncomfortable to go there. I'm talking about a non-South African. Then how about a young person who is scared to go to the facility? Our young people, they are not comfortable to go to the public sector because, one, of the discrimination, two, because of the judgments that they are getting, a stigma to say it's time for you to be at school. You are very young. Why are you here for prep? Why do you want prep? You want prep because you have multiple sexual partners. There is a lot that we need a journalism or a journalist to work on, and also cover these young people who are willing to speak out to say, why do we need these services? Because at the end of the day, besides being sexually active, the sexual violence, it's there, and it's affecting our young people. I can talk the whole day, Mama Ponya, about these issues.
I mean, you raise such important facts. I think one of the ones that is important for me, and everything you said, it's worth pondering on. But I think the one that that I want to come back to, which is very important for our newsroom colleagues, is the issue of who are you serving in your stories. So when we decide what the top story is and what the story that is worth that media space is, for whose interest is that story? Because I think answering that will help us a lot, but it will also, because of how much trouble newsrooms are in right now, and part of that is because people feel very disconnected from, especially mainstream media, feel very disconnected from the agenda of the mainstream media. And I think it comes back to what you were saying, that, when it's time to listen to the young people, journalists are nowhere to be found, and they're chasing some other story that somebody else thinks is important, but not the people that they are supposed to be serving. And I think that's an important consideration, and something that as journalists we have to speak about in our newsrooms. Who are we serving? The stories that we choose. If our communities are in so much distress and are in crisis, then how are we selecting what we are giving a voice to? Sibongile, I don't know if you have some thoughts on that, and maybe Sibongile, if you could also, Sibongile, and if you could also maybe just your thoughts on the way forward where we are now with with the funding crisis. Just giving more of your thoughts on how journalists can help in steering our governments and our people towards the right direction.
Just quickly, Mama Ponya, before Sibongile comes in, I'm sorry to be judgerach. I just want each and every journalist here to check how many followers they do have on their social media. We know that in the mainstream, you are so restricted and others. But if you love what you're doing, you can use your social media, because I believe that most of journalists, they have number of followers, and this number of followers are young people. Use the mainstream and then the media, the social media, your followers, to give these stories about young people, cover them. I think that's where we'll get them in terms of young people. I'm so sorry for taking a little bit of your time.
That's very welcome. Thank you. Sibongile Ann?
Yeah, I agree with Sibongile. I think, as we're talking about this conversation, I'm just thinking about where we come from, as a previous journalist, and just saying, I do think, and I saw someone commenting on this, the role of editors in this. And I guess you have to ask yourself two questions. And journalism is a very interesting career path. Journalism is about storytelling. And I don't know, and it feels worrying sitting here, and I'm worried about the institutions that are teaching journalism, because when we were in journalism school, one of the things we were taught about is, how do you pitch for a story? How do you fight for your story? How do you insist on your story, right? And I don't see that passion anymore. I see a lot of interest to write stories, but not to answer the critical questions that you said, Mama Ponya, about who am I writing the story for? What do I want the story to, where do I want the story to go? And therefore, who do I need to partner with that are already in the system? Because journalism is about social change. It's not about, even as a lifestyle reporter, your role is to document for social change, whatever form of social change that we need, right? And therefore, I need to be as close as possible to people in the treatment action campaign. When I was a reporter, I made sure that I keep those contacts. I made sure what Sibongile was saying, I create the space and the time to go to those community dialogues and hear the stories and find the people. And therefore, I do think there's a complacency, even it's a broader system, and it looks like there's an institutional issue from even universities, that they need to do a lot more about asking, why do you become a journalist? Journalism is the same as activism. I am telling you right now, Sibongile will tell you, we are sitting here in our desks right now. We do not know where our next meals are going to come from in the next few months. But because we don't do it for our careers, we do it for the change we want to see in our societies. And therefore, we still are here. And therefore, if journalists don't think of journalism like that, you guys can develop the tools, you can give them so many things, but if they don't see that journalism is about social change, and you have to go into those newsrooms and fight for your stories, and if you can't get them in the newsroom, then create the platform yourself. So as Sibongile said, if you do have the platform, then create and tell that story. But journalism fits into a bigger systematic change work. And journalists can't tell the stories alone. They need to understand that there are people who are working to push for advocacy. And therefore, how do you work for advocates like Tasha and Sibongile to make sure that you tell those stories? And then when it comes to the funding crisis, I think and I don't call it a funding crisis, to be really honest. I think the US governments and the global North governments are making a decision. What they are saying is that we've invested in the global South countries a lot, and we are looking at our own interests now. And every government has the full right to do that. It's painful, but it also speaks to the issue of decolonizing development. I think for the longest time, we've been talking about, Sibongile can tell you, and there's also that conversation that journalists can report on the issue of aid in Africa. we've seen how aid does not develop us as a continent. And yes, we were not prepared, the rapidness. And this shows what happens when power lies in another person. And therefore, at this moment, at this juncture of our lives, which is difficult for all of us in the space, we are asking ourselves critical questions that we never had a chance to ask ourselves, in that, how do we do this work with limited resources? We got spoiled. Sibongile can tell you, we got really spoiled because we started waiting, oh, we need to do this, or we don't have the money to do it. But that's not where activism started from. Activism started by mobilizing with nothing. And I think now we are back at that, where we have to rethink our budgets, where we have to ask ourselves, do I need to be a full-time employment or am I a contract worker? Because for us, this work has not been about being employed, for instance. It's about changing our communities. And there's a lot of stories that journalists can tell me that can, I mean, the simplest story is, have journalists gone to organizations that Tasha works in and ask, what is the impact, the real impact, and how are they surviving? What is the resilience that they are building? Because I do feel, from what I'm hearing in countries, from our work on our side, what we've been doing is really consulting in countries, because we understand the people that are affected the most are people on the ground like Sibongile and Tasha. And on our side, what we've been really, really, really inspired by is the resilience and the innovation that is happening, that people are still saying, you know what, we will still do this job without the US funding. And those are the stories that Sibongile was saying that are not being told. And how can you tell those stories if you are not having conversations with Sibongile, if you don't sit down with Sibongile? But at the same time, I think I want to ask the journalists in this room that fight for your story. That's how we told our stories. When I was a reporter, health journalism had one page at the Mail and Guardian, one page. It was a supplement. It was sponsored by someone else. And every day, every week, I would go to the news editor and say, and fight. And then also you need to learn your editors. So your editors, you must know what is the hook that they like. So if they like things like, if there's a bit of drama that they like, you can still create drama with a story that changes people's lives. You can tell them, this is the hook, this is where, and you will see, and I do think it's the pushing, because we used to push for stories. It was never also easy for us to report on health journalism. But we got lucky because there were institutions such as Health E, which was created. And I'm also going to ask the media fraternity to say, people who are UNAIDS here, and at least UNAIDS, and I don't know what the funding for UNAIDS will look like, but how do we set up agencies for health? Because those ones, they are able to report on health, and then they are able to sell them to the mainstream media. And it decreases the burden also on the mainstream media to report on these issues. But that's another conversation on my side. But I think there's great opportunities around innovation and resilience that are coming from countries. Yes, it's bad and people are feeling it, but people are resilient, and especially people that are working in the advocacy space, particularly in key populations and HIV. And I want to call journalists to report on those stories of resilience, because those are important, because what they're going to do is also going to shift the US governments and and other governments to see that, oh, these are the opportunities then we can fund. Because I think the big question, and yes, the US is asking about the gender. We see where they are moving around the gender issues. But other countries in the EU are now asking critical questions. We've been getting a lot of conversations from their governments to ask us, so we can't feel the US government funding, but what are the opportunities that you guys are seeing in the countries? And the minute we tell them that Sibongile has organized a meeting with the minister, they are asking the minister to make sure that they fill the gap. They are holding their governments accountable. Those are the things that they are like, oh, we can see what we can fund then. Then we are willing to fund service delivery in countries. But we need journalists to actually have partnerships with organizations that are working on the ground. Because they have the great stories and they have the solutions. And your job is to just document those solutions and the resilience. Thank you.
Thank you, Sibongile. Excellent contributions there. Just quickly, Tasha, your thoughts on how not just Fem Alliance, but just in terms of HIV response, particularly though amongst the vulnerable groups in Uganda, were your thoughts on right now what you feel like journalists can help with and what they should be focusing on?
Well, on our side, our thoughts and what journalists could be focusing on, number one, writing the right stories about the community or the the marginalized communities. Then number two, focusing on the everyday life experiences of the persons living with HIV and those who identify as LGBTQI. And then three, they could focus on ensuring to support us have changes in the current AHA. We reappealed and they removed some aspects, but one aspect still speaks to the other, and it's hard for us to work when we're in a criminalized environment. And if journalists can talk about the things, I know, like you said, mentioned earlier, that it eventually looks into the population's attitudes, and there's an attitude change. Because here in Uganda, yes, the law is in place, but the most people who use it against the community is the persons around us themselves, because they're ignorant about the laws. They don't know the specific aspects around those laws. They use it to their own advantage. For instance, if you go to go get any services, the health worker may refuse to give you the services with the claim that we don't support LGBTQI persons. We refuse to work on you guys. Why are you here? You're being discriminated against. Like, it's a whole lot. So if we can have the attitude change, and I know journalists are good at that, and they talk to the real facts than speculations, then it would bring a very great impact on our side. And then also maybe like the last speaker said, we need to focus on re-strategizing. Yes, the funding is no longer there. What next? So probably through the journalist stories and their support in media, we might eventually other donors who don't particularly support LGBTQI organizations but support other aspects of a human being, like maybe health aspects, they will be more open-minded in supporting us. So yes, we need to have these conversations with journalists, and we need to have this being showed out there. So I believe, yeah, they can be very impactful, and those are some of the changes we want to focus on. But
Yeah.
our biggest challenge here, the criminalization. If the journalists can speak to that, it will be the best thing they can do for us.
Mm. I see Joyce wrote in the chat group that in Kenya, the activists there have been demonstrating at the Ugandan embassy in Nairobi over human rights violations. And those are exactly the kind of things we want to continue to see. Just quickly in closing, we've run a little bit out of time, but I do want to give you guys to say just one last just your thoughts, Spongile and Spongile T and Tasha. Maybe Tasha, we start with you. Your closing thoughts as we end this discussion.
Oh, yeah. Thank you very much. So I believe that by focusing on those areas around the challenges we are facing, the frontline experiences, the stories, the funding impacts, government accountability, inclusive narratives, and probably as we proceed in life, the digital innovations, we can create more compelling and truthful narratives about what needs to be done to support persons affected by HIV. And with the support of journalists, even if outside our country, in various spaces, we believe there will be great impact, and we can drive this change together. So I'm looking forward to a change despite these very many hurdles that keep on coming up. Thank you.
Thank you, Tasha. Sibongile Nkosi?
Yeah, I think it's just, again, I think you asked such a critical question is to, just to think about the stories that you want to tell as a journalist. And again, think about the partnerships that you want to build in this journey, but also, really think honestly about the stories that you want to tell and fight for your story, because your editor is just an editor really sitting there, and they are continuously asking critical questions around your stories. Editors are always going to be like that. And therefore, and I do think what Sibongile said was quite strong around, it's 2025. There's more platforms. You know, when we were writing stories and your story didn't make it, it just ended there. But now there's a much bigger platforms, and to think more creatively how you can use your platform, and think about the reporter that you actually want to tell. And right now, more than ever, we do need journalism in the HIV response as we transition into HIV integration with the public health. And therefore, there's, as I said earlier on, there's going to be quite a lot of need for public health reporting, particularly with the HIV integration agenda as we move. Thank you. I need to go off because they're just waiting for me in another meeting. But really, thank you for having me, and really enjoyed this conversation. Thank you.
Thank you for joining us. Sibongile Chabalala?
For me, I think my last words will be, we need each other. We need to work together. And, journalists, we need you more, because at least, your voice is louder than anyone, and you can tell the stories as they are. And without even where we are, remember from where we are coming from, journalists were the ones who were telling our stories to say people are dying. This is what people living with HIV are doing. And we're able to fight, and we're able to have all these successes because our stories were told at that time, and that's what we need now. And mostly important, with all what is happening in the world, we need to know what is happening to our brothers and sisters in our neighboring countries, so that we can be able to voice more or advocacy to other funders to say, as much as countries needs to take the responsibility of their own people, but we can't allow people to die like this. If people in Zimbabwe, in Mozambique, in Malawi, in Kenya, they don't have ARVs, then it's a concern for me in South Africa, who can receive 14 days treatment or 20 days treatment. I'm not saying that it's enough, but we need everyone to get healthcare services. Everyone needs to have access of ARVs. It doesn't matter how much funding does PIPFA fund in that a particular country, but we need to tell these stories. If I'm able to speak out for my neighbors or for my community in Zambia, in Malawi, in let it be. Let's use this platform. We are here to fight for each other, fight together, and together we can win all these challenges that we have, and we can speak out against all ill treatments that we are getting, all suppression that we are getting, and everything. As Africans, I always say, we are intelligent. We can do this. We can fight, and we can conquer. Thank you very much.
Thank you so much. Thank you to all three of you. That was really food for thought. There are some things here that if I was a journalist, I would really be wanting to do a podcast type, because there's so much to discuss. The issue of decolonizing aid, I find that so interesting. I think we could talk for hours about that and exchanging ideas, practical ideas. But I thank you, Sibongile Chabalala Matlala. Thank you, Tasha Muira. Thank you, Sibongile Nkosi. It was an honor having you here, and I hope that the journalists here have also taken your names and your details and will follow up. Just in the chat group, I see some comments. They are noted. Some of you were just adding to what is being said in the conversation. I want to, Faith Kutere, you mentioned the issue about the stigma around how people are infected with HIV. people thinking that always linking HIV infections with immorality and how that is still so prevalent and we need to deal with that. Thank you for that. I also want to again thank UN AIDS and SANEC for being our partners in this, and thank you for giving us an opportunity to come and work with you on such a great project, and we look forward to taking this further. But I want to say, as in closing, before I hand over to my colleague Bridget to just close, I want to share with you. There was a drama. I can't forget its name. I can't remember its name. That was showing on these streaming platforms a few years ago, and in the story there were two brothers who were from an autocratic family. So their father was the ruler of the country, and he had died. So the one brother took control of the country, but the brother who took control of the country was very cruel. And in fact, the series opens with him randomly going to some house and raping the wife because he can, because he runs the country. Um, and towards the end, the other brother wants to take over from his brother, and so he's planning a coup. And so he gathers a bunch of people to help him plan for this coup. And one of them says to him, "Do you have the three M's of a coup?" And he asks, "What are the three M's of a coup?" And the advisor says, "The first is money. You need money to have a successful coup. The second is military. You need to have a strong enough military. And the third is media." And that has always struck to me because that talks about the importance of why our journalists are so important. The stories that you tell literally shape people's perceptions and attitude. They save lives or destroy lives. So it's really important that we not take our and responsibility lightly. And I hope that you will engage with the topic more meaningfully and we will see more meaningful stories. And again, thank you for joining us. And I'll hand over back to you, Bridget.
Thanks, Mama Ponya, and thanks everyone that is still on our webinar. I hope it reignited your enthusiasm for reporting on HIV in our region. Thanks particularly to our passionate panelists who shared their perspectives of working at the coalface of the HIV story. I think there were some great tips there about how journalists need to clarify the questions they want answered, what social impact they want their story to have, how to be a bit more creative about the storytelling. And we hope that our manual will be useful for that. It's got lots of useful facts that you can use. But what I think we learned today, that will help you give you the confidence to report on the story, but it's not just about the facts. It's about the broader context of public health service delivery. And we aren't, of course, just reporting about numbers. We're reporting about people. So remember the human lens. So thank you also to our partners that worked with us on this project. And for those of you that joined and engaged, please download the manual. Please share it widely. It will be on the freycollege.com website as well. And let's keep the HIV story alive. Goodbye.
Thank you. Bye.
Bye.
Thank you. Bye.
Thank you. Bye.
Thank you so much. Bye-bye.
Bye.